Hello guys, this is Dr. Possibility from Excel Academy. Kindly make sure that you subscribe to our YouTube channel and make sure that you register with Excel Academy. In this class, I'm just going to have a close anatomy revision with you on the brachial plexus. Please make sure that you subscribe to our YouTube channel. When you talk of the brachial plexus is just a branch of nerves which supplies the upper limbs and also the upper part of the body. And when you talk of the brachial plexus, it comes from the C5 to the T1. That simply means that from the C5 we have the C6, then we have the C7, then we have the C8. The brachial plexus is being divided into the roots, trunks, divisions, cords, and also the branches. The branches just consists of different types of nerves. Remember that not all nerves come from the cords. Some nerves might even come direct from the roots. But I'm not interested in labeling the whole of this diagram because I have a tutorial video on this which you need to watch. Let's quickly look at the gross anatomy test. For this question, we have been given label the structure marked with red arrow. So the structure marked with the red arrow is just the medial cord. The structure which is marked with the red arrow is just the medial cord. Then the next question is label the structure marked with the yellow arrow. So the structure which has been marked with the yellow arrow is just called the lateral cord. The question is, how have I been able to identify that this is the lateral cord and that is the medial cord? This is very simple. We need to understand that we have three types of cords. The first cord we have is the medial cord, which is this one. Then we have the lateral cord, and then we have the posterior cord. All these cords are being named in relation to the axillary artery. And when you talk of the cords can be found just below the clavicle. So you need to understand that up there was a clavicle. So once the clavicle has been removed, below the clavicle, you need to find the cords. In this picture, it is very hard and impossible to see the axillary artery. But in the next slides, we will be able to see the axillary artery. But in this case, for you to know that this is the medial cord and this is the lateral cord is by using the side from which these cords are. So if you look at the lateral cord, it is on the lateral side of the body, and the medial cord, it is on the medial side of the body. The other way in which you can notice this cord is by writing the famous letter M. So the famous letter M is formed by the musculocutaneous nerve. So this is the musculocutaneous nerve which is innervating the biceps, which is also innervating the coracobrachialis and also the brachialis muscle. And then this musculocutaneous nerve is just coming from the lateral cord. So when you have this musculocutaneous nerve, it will come from the lateral cord. Then this lateral cord will send a lateral branch of the median nerve. So this is the lateral branch of the median nerve. And then when you go down there, you are going to find this nerve, which is the median nerve. This median nerve has two origins. It has the lateral branch of the lateral cord and also the medial branch. So when you go this side you are now reaching the medial cord. And then from the medial cord, you are going to have this particular nerve, which is known as the ulnar nerve. So this letter M can also help you to know what is the name of this particular cord and what's the name of that particular cord. So let's quickly move on and look at the other question. The next question is saying label the structure marked with red. So we need to understand that for us to be able to identify this structure marked red is by first identifying what this structure is and what that structure is. So we need to understand that the brachial plexus, which is having these nerves, and this brachial plexus is just near the what? The pectoralis minor. So the structure in yellow is the pectoralis minor. The other way you can know that this is the pectoralis minor is in such a way that this pectoralis minor, it is the one which is separating the axillary nerve, the axillary artery into 3 different parts. Not only that, you can also look at this muscle being innervated by the what? By the medial pectoralis nerve. So the medial pectoralis nerve, it's normally pierces the what? It's normally pierces the pectoralis minor. So the other way you can know that this is the pectoralis minor is just by noticing this medial nerve, medial pectoralis nerve, which is piercing it. Then right on top of these muscles, on top of the pectoralis minor muscle, you're going to find this nerve. So this nerve is normally the what? The lateral pectoralis nerve. The lateral pectoralis nerve, which is coming from the what? From the brachial plexus. So we have the lateral pectoralis nerve. Okay, then we have the next question, which is label the structure marked with yellow, which is just the pectoralis minor, the pectoralis minor muscle, which is just a muscle, and this muscle has been pierced by the what? Medial pectoralis nerve. Let's quickly move on and look at the next structure. The next structure, we have been asked to label the structure marked with red arrow. So for us to notice that this part, whether it's a nerve or it's an artery, you can just simply look at the thickness, and also you can just look at the movement. So if you look at this this guy, this is actually an artery, and this artery is normally branching off from the axillary artery, and then the axillary artery is giving rise to the what? To the subscapular artery. So this part where I'm shading here is just simply the subscapular artery. In some literature, it will be indicated as the what? The common tract. So this guy will give a branch, and this branch which is going toward the thorax region, it is just known as the what? The lateral thoracic artery. So that is just simply the lateral thoracic artery. So the guy which has been indicated with the arrow red is just the lateral thoracic artery. Then we have the question which is saying label the structure marked with yellow. So the subscapular artery will give rise, or it's going to branch into the what? The circumflex what? Circumflex scapular artery. So the circumflex scapular artery is the one which normally goes behind, and then you have another artery which is going forward, and this artery, it is going to innervate the what? The latissimus dorsi. So this artery is just known as the what? The thoracodorsal artery. So the answer of that is just thoracodorsal artery, and this thoracodorsal artery is normally supplying the what? The latissimus dorsi. Let's quickly move on and look at the next question. The next question is label the structure marked with what? With the red arrow. So if you look at the structure marked with the red arrow, you need to understand that this is the lateral branch of the what? Median nerve, and this is the musculocutaneous nerve. So if you look at this structure which is making an M somewhere, remember that the ulnar nerve has been hidden by this instrument. So once these guys are being separated, there is this structure which has been exposed. So this structure which has been exposed is what we are calling the what? The axillary artery. So you need to take note of the axillary artery. This same axillary artery is the one which is having that part, this part inside there, and this part, it is the one which is giving rise to these branches of arteries. Like you can see here, it is the circumflex scapular artery, then there you have the lateral thoracic artery, and then down there you are having the what? You are having the thoracodorsal artery. So this artery, which is the axillary artery, is a very important artery which will help us to be able to name the what? The chords. Like this part is the lateral cord, there you have the what? The medial cord. And lastly, we are going to see the other cord, which is known as the what? Which is known as the posterior cord. So let me quickly move on and look at the next question, which is label the structure marked with the yellow arrow. So do not confuse this structure with the structure which is moving up there. So this structure is normally piercing this muscle. So if you look at this muscle, this is the pectoralis minor muscle. So the only thing which is piercing it is what? The medial pectoral nerve. So this one is just the median pectoral nerve. So please make sure that you follow up and make sure that you are able to identify this structure. So that structure is just the medial pectoral pectoral nerve. Okay, medial pectoral nerve. And this medial pectoral nerve, it is just simply piercing the pectoralis minor and also going to innervate the what? The pectoralis major muscle. Okay, let's quickly move on and look at the structure. So on this guy, we have been asked to label the part marked with a red arrow. So if you look at this part which has been marked with the red arrow, in this case, the median nerve has been removed, and also other nerves have been removed to the other side. So the only structure which we are capable of seeing here, this is just the the axillary artery. So this is the axillary artery which has been exposed. The next one is, which structure separate the structure shown by the red arrow into three parts? So the structure which is normally separating this guy into three parts is just known as the what? The pectoralis minor muscle. The pectoralis minor muscle. So the pectoralis minor muscle, it is the muscle which normally divides the axillary artery into three parts. And you need to know that this axillary artery was before known as the what? As the subclavian artery. So when the subclavian artery reaches the axillary region, it changes the name to the what? To the axillary artery. And then as this axillary artery approaches the elbow joint, it's going to change into what? The brachial artery. Okay, so let's quickly move on and look at the next question. The next question is one, label the structure marked with red arrow. Okay, what could this red arrow be? So one thing we need to understand is that this axillary artery has been put on the other side. So this is the axillary artery like you have observed, and this axillary artery is sending this common track, and this common track you can refer it to the what? To the subclavian artery. So when you look at that, you need to understand that this artery is normally going to expose a part of the brachial plexus which is on top, and this part on the red part, this is just the what, the posterior cord. So this is just the posterior cord. Okay, so posterior cord. All right, and then this posterior cord, which is this guy here, is giving rise to the important branches. One branch, it is this branch here which is going there, and this branch is in relationship with an artery here. So this artery is known as the posterior circumflex humeral artery. So this artery is just the posterior circumflex artery. So the posterior circumflex artery is entering the quadrangular space together with another nerve which is coming from the posterior side, and this nerve is normally known as the what, the axillary nerve. So the answer on that part is just the axillary nerve. Okay, so let's quickly look at the next question. So if we look at the next question, what is it saying? So the next question is, state the structure that are innervated by the structure shown in yellow arrow. So the axillary nerve is normally innervates the what, the deltoid muscle. It's normally innervates the deltoid muscle. Yeah, so the deltoid muscle is normally innervated by the axillary nerve. So the answer there is just the deltoid muscle. All right, let's quickly move on and look at the next question. The next question is, label the structure marked with the red arrow. So the structure marked with red arrow, in some books it is written as the subscapular artery. So this is just the subscapular artery. Okay, so this is just the subscapular artery. But for some books, because of this branch which has come out here, which is the lateral thoracic artery, so some books they will refer this part to be the common track. Yeah, this is known as the common track of these arteries, but mostly the answer is just the subscapular artery. Then label the structure marked with yellow, and this structure which is moving, which is a branch of that, and this branch is normally supplying the what, the latissimus dorsi. So this is just the thoracodorsal artery. So thoracodorsal artery. So you have the thoracodorsal artery. So the thoracodorsal artery, it is an artery which is normally moving along with the what, the thoracodorsal nerve. So the thoracodorsal nerve, which is this guy here, this nerve is normally coming from the what, it's normally coming from the posterior cord of the brachial plexus. So this nerve which you are able to see here, this nerve is just known as the what, the thoracodorsal nerve. And then there is another nerve which you can notice, like there is the posterior cord which has been hidden by the arrow. So there is this nerve which is the thoracodorsal nerve, and then there is an artery which is the thoracodorsal artery, which is the branch of the subscapular artery. So the thoracodorsal nerve, which is branching from the posterior cord of the brachial plexus, it normally comes out with another nerve, which is this nerve, and this nerve is normally known as the what, the lower subscapular nerve. I'm sure this will be explained in the next slides. So we have been given this question, and the question is, label the structure marked with red and the yellow. So the structure marked with yellow, the structure which is marked with yellow is just the posterior circumflex posterior circumflex, humeral artery, posterior circumflex humeral artery. Yeah, so the posterior circumflex humeral artery, it is just a branch of the axillary artery. So the way you cannot confuse, because there are two things that are entering the quadrangular space. There is the axillary nerve and also the posterior circumflex artery. So for you not to get confused, or for you to know which is which, so you need to understand that the posterior circumflex artery, it's normally branching off from the what? It's branching off from the axillary artery, and then the axillary nerve is normally coming from the what? The posterior cord of the brachial plexus. So the next one is the red guy. So if you look at the red guy is coming from the posterior cord of the brachial plexus, and this red guy, do not confuse it with the ulnar nerve. So this red guy is just the what? The radial nerve. So this is just the radial nerve. Okay, then the question is, state one structure that is innervated by the structure shown in a red arrow. So the radial nerve, it normally goes round and it's going to innervate the tricep muscle. So this guy, it normally goes and innervates the tricep muscle. Okay, so take note of that and also the points I've raised on this particular slide. Let me move on and look at the next one. The next one is label the structure marked with red arrow. That's just the lateral thoracic artery. Lateral thoracic artery. Thoracic artery. And then the next question is label the structure marked with yellow arrow, which is just the subscapular artery. Subscapular artery. Okay, subscapular artery, which is a branch of the axillary artery. So let's quickly move on and look at other parts. Label the structure marked with red and yellow arrow. Okay, you need to be a little bit careful. When it comes to the nerves and also the arteries. So the arteries have identified this side. This is the lateral thoracic artery, and there is this part which is the scapular artery, and then there is this artery here which is the thoracodorsal artery, and then there is this other artery here which is the circumflex scapular artery. Then there is these nerves which are coming this side. So there are nerves which are coming from the posterior cord of the brachial plexus. So the first nerve you can notice is the one which is on top there. There is this nerve which is on top there. This nerve is the upper, is just the upper subscapular artery. So the upper subscapular nerve. So this is just the upper subscapular nerve. Then there is this other nerve which is going toward the latissimus dorsi. So this nerve is just the thoracodorsal nerve. Thoracodorsal nerve. Okay, so the thoracodorsal nerve which is going to supply the latissimus dorsi. Then there is this nerve which has also branched off from the posterior cord of the brachial plexus, and this nerve is known as the what? The lower subscapular artery. So in short, the yellow guy is lower subscapular artery. So the yellow guy is just the lower subscapular artery. Lower subscapular artery. the lower subscapular artery. Then the red one is just the thoracodorsal artery. So thoracodorsal nerve. So this is just the thoracodorsal nerve, and that one is not an artery, sorry, that's a nerve. That's a nerve. All right, just that these names, the nerves and the artery, normally they have the same name. So yeah, so this guy, like I've said, this is the lower subscapular nerve, which is branching from the posterior triangle. Then you have the thoracodorsal nerve, which is also from the posterior cord, and also you have the upper subscapular nerve, which is on top there. State the structure that are innervated by the structure shown in red arrow. So the guy which is going this one, it is just the latissimus dorsa. Yeah, the latissimus dorsa, which is one of the muscles of the back. Okay, let's move on and quickly look at the next question. The next question is, label the structure marked with red and yellow arrow. So how can you notice the red arrow? So the red arrow, you need to know that this is the lateral cord and this is the medial cord, and this medial cord is giving a branch, and this branch is normally forming the median nerve, and this median nerve, it is a nerve which is being created by the lateral branch and also the median branch. So when you talk of the red guy there, it is the medial cord branch, the medial cord branch of the median nerve, all right, median nerve. So the median nerve is an important nerve which will go up to the thumb and also innervating the muscles of the thumb, the muscles of the foramen, the muscles of the index fingers, and many other muscles. Okay, let's quickly look at yellow. What is yellow? So yellow, if you look at, this is the median nerve, this is the lateral branch of the median nerve, this is the medial branch of the median nerve, and then you have another nerve which is coming from the medial cord, and this nerve is just the ulnar nerve. So the yellow guy is just the ulnar nerve. Yellow is just the ulnar nerve. Okay, so make sure that you take note of that. Okay, let me quickly move on. State the medical condition associated with the injury to the structure which is named by the yellow guy. So what do you think can happen if at all the ulnar nerve was damaged? What can really happen when the ulnar nerve is being damaged? So let's quickly look at something that we need to understand about the damage of the ulnar nerve. So mostly when the ulnar nerve is being damaged, this will lead to some pain and numbness on the forearm and the fourth and the fifth fingers. So you need to understand that this ulnar nerve, it will normally cause some numbness and also the pain on the forearm, and also when you talk of the fourth and the fifth fingers, because this nerve normally goes up to the fourth and fifth fingers where they normally innervate those muscles. So with that being said, we need to understand that there is another condition which is as a result of the ulnar nerve, and this is normally known as the what? The claw hand. So another guy you need to put here is just the claw hand. So a claw hand is normally caused due to the damage of the ulnar nerve, and this damage of the ulnar nerve can be observed by the pain on the forearm and also the pain on the fifth and the fourth fingers. Okay, let me move on and look at the next guy. So the next guy is easy. Label the structure marked with red arrow. So red arrow, red is just the lateral pectoral nerve. Lateral pectoral nerve. So lateral pectoral nerve. And then the yellow guy, that's the pectoralis major muscle. That's the pectoralis major muscle, which is innervated by both the medial pectoral nerve and also the lateral pectoral nerve. So those two nerves innervates the pectoralis major muscle. Okay, the structure marked with the red arrow is a branch of, okay, so what do you think the lateral pectoral nerve come from? So the lateral pectoral nerve is normally branch off from the lateral cord and also on the lateral cord. Yeah, it normally comes from the lateral cord. So the lateral pectoral nerve is normally branches from the lateral cord of the brachial plexus, so you need to take note of that useful details. Okay, let's quickly move on and look at the next guy. The next guy is label the structure marked with red and yellow arrow. So the red guy there, you need to understand that this is the lateral cord. It's giving the branch. So this is just the lateral branch of the median nerve, the lateral branch of the median nerve, which is just simply coming from the lateral cord, and there you have the musculocutaneous nerve, and there you have the lateral cord. This is the medial cord of the median nerve, and then you have the median nerve. Then the yellow guy is a muscle. This should not be mixed with that. This is the bicep. But when you talk of the yellow guy, it's not pointing on the biceps. Instead, it is pointing on the coracobrachialis. So this is just the coracobrachialis muscle. So the coracobrachialis muscle is the muscle which is normally being pierced by the musculocutaneous nerve. The coracobrachialis muscle is the muscle which is normally being pierced by the musculocutaneous nerve, and this musculocutaneous nerve will normally supply the biceps. It will normally supplies the brachialis and also the coracobrachialis muscle. State the innervation of the structure marked by yellow arrow. The innervation they're just simply talking about is the musculocutaneous nerve, which is the branch of the lateral cord of the brachial plexus. Okay, let's quickly move on and look at the next question. Label the structure marked with red and yellow arrow. So the red, it is just the yellow is the musculocutaneous nerve. Musculocutaneous nerve. So the yellow guy is the musculocutaneous nerve, and then the red guy, it is coming from it is coming from the medial cord, and this red guy, it is normally known as the medial cutaneous nerve of the forearm. So this guy is coming all the way from the medial cord, and it's going all down to the medial side of the forearm, or forearm, foramen and forearm, I'm normally mixing them up. So the medial cutaneous nerve, the medial cutaneous nerve of forearm, the medial cutaneous nerve of the what? Of the forearm. So make sure that you take note of that. We also have the medial cutaneous nerve of the arm, but that cannot be seen on this cadaver. Then we have stated the structure that are innervated by the structure shown with a red arrow. So the medial cutaneous nerve of the forearm, it's normally gives the sensation to the what? To the medial side, of the forearm, medial side of the forearm. Okay, the medial side of the forearm, and then it also supplies the skin. It also innervates the skin of the forearm. The skin of the forearm. It's normally innervates that region. Okay, let me quickly move on and look at the next one. Label the structure marked with red and yellow arrow. So if you look at the yellow one is the lateral cord. The yellow one is the lateral cord. I'm pretty sure by this time around you can just easily identify this. Then the red guy is just the musculocutaneous nerve. Musculocutaneous nerve. Okay, so please just don't mind my handwriting. Then state the structure that are innervated by the structure shown in red arrow, which is the musculocutaneous nerve. I think this I've already stated it. You have the coracobrachialis muscle, which is normally being innervated by this muscle, by that nerve. And one thing you need to understand about that nerve is that it does not just innervate the coracobrachialis muscle. Instead, it pierces the coracobrachialis muscle. So when it pierces the coracobrachialis muscle, it's going to innervate other muscles such as the brachialis muscle. Okay, and then the other muscle which is innervated by this same nerve, it is the biceps brachii, which is also another muscle of the arm. Okay, let me quickly move on and see if we have anything. So I think, guys, this is where I end on my discussion with you on how you can identify the different parts of the brachial plexus, especially when you talk of the axillary region. So please make sure that you subscribe to our YouTube channel, and if you have any questions, please contact me on the numbers on the screen, and make sure that you register with Excel Academy. Thank you very much and have a blessed